Hello, welcome to our 9 North Compass program. 9 North is jumping into the community conversation on timely subject matter that has been magnified because of the pandemic. Throughout 2021, we will be hosting a series of listening sessions about controversial topics that impact your community. Today, we examine food insecurity in the North Suburbs. 1 in 9 Minnesotans do not know where their next meal will be coming from. It affects everyone from children to seniors. We have joined 3 experts in the field to learn how this impacts our local community, what local organizations are doing, and how you can help. My name is RAMUNDT, co-founder of Do Good Roseville, a group that makes connections to share ideas and information in order to do things that have a positive impact on our community. Today's program is a perfect example of ways we can learn more about our neighbors and resources in the community. We will see how food availability has been impacted by the pandemic. THERESA McCORMICK, the Director of Programs and Healthcare Partnerships at Second Harvest Heartland, joins us first. A surprising number of our neighbors are doing something they never imagined, visiting a food shelf for the first time in their lives. Second Harvest Heartland is one of the largest, most efficient, and innovative health relief organizations in the nation, working in partnership with a network of nearly 1,000 food shelves and hunger relief programs. Second Harvest Heartland helps 1 in 9 people, including 1 in 5 children in Minnesota and Western Wisconsin who experience hunger. Our second panelist is Christine Weber, Program Manager for Every Meal. During the spring of 2010, the school administration of Sheridan Elementary in Northeast Minneapolis discovered that students hoarding food from the cafeteria on Fridays. More than 90% of the students at Sheridan received free and reduced lunches, and many students were taking extra food home to eat during the weekend. A response to this need was the Sheridan Story, which is now called Every Meal, a project designed to fight child hunger by providing a weekend supply of food to hungry children. Third is KRIS ROSSOW from the Roseville Area Senior Program. She's the coordinator of the Meals on Wheels program there. Local Meals on Wheels programs are on the front lines every day, focused on doing all they can to keep older Americans safe and nourished in communities across the country. They meet neighbors in their homes and see the impact of food insecurity on a personal level. Welcome to each of you. We have a series of questions that we'll ask in rotating order. If you're ready, let's start with THERESA. THERESA, can you tell us how big is the problem of food insecurity in the North Suburbs?
Yeah. So if we had been having this conversation at this time last year, I would have told you that 1 in 11 adults did not know where their next meal was coming from. And you're right, in the introduction, that has dramatically increased because of the pandemic. And we're now seeing that 1 in 9 Minnesotans, including 1 in 6 kids, is living with hunger right now. Hunger is pervasive and it's touching every community in Minnesota, including our home here in the northern suburbs. Recent data from Feeding America shows that the degree of food insecurity is increasing at an equal rate all across our state right now. So that means we're seeing that increase to that 1 in 9 Minnesotans right here in the northern suburbs. And it's the same rate of increase that we're seeing, whether that be in St. Paul, Coon Rapids, Mankato, Minnetonka. In the last 10, 12 years, we've made slow and steady progress reducing food insecurity in Minnesota since the Great Recession. But COVID-19 has really undone that progress, and we're now seeing a record number of people experiencing hunger right here in the Heartland.
Wow, thank you. Wow, those are dramatic numbers. Shocking, actually. Next, let's go to Christine from Every Meal. Christine, can you tell us, speaking of children, how big the problem of food insecurity is?
Yeah, absolutely. First, before I get to that great question, I'd also just like to level set and define what food insecurity is. We on the panel, we work in this sphere every day, and it's language that we talk about, but for those tuning in, it may be a new concept. And for a lot of our volunteers and people I come across, it's not necessarily something that they're familiar with. So the USDA defines food insecurity as a lack of consistent access to enough food for an active and healthy life. Another definition that I really like is a lack of access to good, healthful, and culturally appropriate foods. So we all have very different definitions of what good food is, but I believe we all have the and deserve the right to have access to foods which fit those parameters, both for us individually, but also for as families and households. So every meal, in regards to how big is the problem, we've seen a tremendous uptick in need for our services throughout the Twin Cities metro, especially since the onset of the pandemic. We currently are distributing roughly 8,000 meal bags throughout the community each and every week, which is the equivalent of about 30,000 meals. And we have partnerships with over 300 schools throughout the Twin Cities metro, and additionally about 60 community sites that are participating in our winter meal program, where our meal bags are available to the public at various sites and hours as well. So the need is great, and we see that only continuing in the months to come.
Wow, those are amazing numbers. 30,000 meals a weekend? That's amazing.
30,000 meals, yeah, per week that are
per week.
Going out to the, yep.
That's an astounding number. I had no idea. So and then let's next go to KRIS from Meals on Wheels, and let's talk about the other end of the spectrum when we start talking about seniors.
Hi, so I am part of the Roseville Meals on Wheels program, and our program serves seniors and disabled adults in the Roseville School District area, you know, those boundaries. And we're also part of a consortium that has eight program consortium that other members are like the Mounds View School District, North St. Paul School District, White Bear Lake, and then programs and Meals on Wheels programs in St. Paul and in some other areas. And just in our 8-member consortium, we saw an increase in the need for Meals on Wheels of a 30% increase from 2019 to 2020, you know, with the majority of that increase, you know, coming after March. So just in our program, in the Roseville program, we saw an increase of 29%, and we served over 5,500 more meals in 2020 than we did in 2019. And so with the pandemic, we have seen just every month as the pandemic goes on, the increase in the need.
Wow, that's, it's hard to believe that it's also, when we're looking at both ends of the spectrum, how big the problem is when you describe it for both children and for seniors. The next question would be, other than just being hungry, what are some of the consequences of hunger? And let's start first with Christine from Every Meal.
Yeah, hunger has a really tremendous impact. It causes families to have increased stress, anxiety, worry that they might run out of food before being able to buy more. Additionally, being food insecure, some families may eat less balanced meals and even skip meals because there isn't enough money to buy food. I, as a registered dietitian, I've studied nutrition throughout the life cycle, from infancy, childhood, into adolescence, adulthood, into the senior years. And really the relationship between nutrition, health, and learning is undeniable. In our work specifically with kids, we know that nutrition really plays such a critical role in both physical and mental development of youth. And research suggests that students are able to better learn. They have fewer absences. They have improved behaviors such as better concentration in the classroom. They have more positive interaction with their peers and improved activity levels when they have consistent access to nutritious foods. Additionally, we know that children who are food insecure tend to get sick more often. So really the impacts of hunger and consequences of it are pretty heartbreaking for kids. So if you can just imagine being in that state kind of perpetually of not knowing where, when, or what your next meal is going to be. That's what so many in our community are facing on a daily basis right now, and many for the very first time.
And to be a kid it's hard enough, especially I think now with the Zoom meetings, to try and focus on school. And if you're hungry at the same time, I don't know how those kids can function in that. But it's interesting how all the other consequences that come from that. KRIS, from Meals on Wheels, what about the consequences on the seniors?
Well, seniors who are living with food insecurity are likely to experience a lot of have health effects. They can suffer from depression, because for many of them, this might be happening for the first time. They might have been food secure for much of their life. And now being food insecure is just not something that they know how to deal with, and they're embarrassed, and they don't know how to ask for help or who to go to for help. So they just kind of ignore it. And then it can lead to depression, which causes further health issues, because if they're not eating, they're not getting all of the proper nutrients that they need. It can impact heart disease. 40% of seniors who are food insecure are more likely to have congestive heart failure. It can lead to diabetes. And most importantly, it could lead to them not being able to stay in their own home because it causes mobility issues and, hygiene issues. And they're just not able to stay home any longer. So which has a financial impact on, the greater community as well.
Wow, kind of a downward spiral of that. If you've never been hungry before, and then all of a sudden you're dealing with that, that's pretty traumatic. And THERESA from Second Harvest, what do you have to say on what are the consequences you see in the bigger picture?
I mean, I would echo everything that Christine and KRIS had shared. Christine said it best, right? The connection between health and food security is undeniable. But the other part, I guess, for me, that gives me a little bolstering, just as a community member myself, is that the community getting involved and really rallying around how we can drive food security for our neighbors, for kids, for seniors, just for everyday families, right here in our community. That has long-term impacts on the health of our community as well, and really can be a way for us to say food is medicine, and this is one of the most important things that our community can rally around so that we can thrive, and every Minnesotan throughout the entire lifespan has the opportunity to thrive.
Oh, great to bring around how it's a community problem. It's not just an individual's problem, it's the community's problem. So thanks for bringing that up. If those are the consequences, those are what some of the consequences of hunger, what are some of the costs associated with hunger? KRIS, can you talk to that a little bit?
Sure. Oftentimes older adults are finding themselves having to choose between buying food and buying medication, which has a huge cost implication for the senior. Many times you need to take your medication with food, and if you don't have the proper food, it impacts your health, even if you are taking your medication. There's an AARP report that nationally seniors face a healthcare bill of more than $130 billion annually due to medical issues related to a lack of nutrition and food insecurity.
Oh.
So that's a large bill every year.
THERESA, what do you have to say on what are the costs, or what are you seeing on the costs of that?
Yeah, well, we certainly see, I think, long-term in what Christine was really starting to describe, the earlier that families, especially with young children, that those children experience that chronic food insecurity, we see long-term costs, certainly in the healthcare space, but also we're starting to really get our arms around what is that long-term cost for those kids. If having consistent access to food actually decreases chronic absenteeism, then what does that mean if a child is food insecure and they are not even able, to participate in school or are getting to class, right? That has long-term impacts on their ability to thrive academically, to attain the level of education, to go on, right? Like that's now we're talking about lifetime worth of costs. And certainly, Christine, please jump in, because I think you guys have some great research at Every Meal that really supports how important it is to build that food security early for kiddos.
I hadn't really thought before about that. If you start when you're young and don't have good food and are food insecure, how that impacts your whole life. Wow, that's I keep saying, wow, it's because I don't know what else to say as far as it's just the numbers and the facts are so shocking and something more people need to know about. Christine, let's talk from the standpoint of every meal. What are some of the consequences? What are the consequences? The cost, I'm sorry.
Yeah, the cost.
I'm testing you to see if you're paying attention.
Right. Yeah, I'm awake. Well, as THERESA alluded to, and as I kind of explained in that consequences question, that children who are experiencing food insecurity, they tend to get sick more often. And one study that I'm aware of, they found that children who are experiencing food insecurity were 30% more likely to have been hospitalized since birth than their peers who were living in a food stable environment. And that just has such tremendous and far-reaching implications. Not only like our hospital stays like really expensive, but parents, they tend to have to miss out on work and they lose out on wages because they have to be available to care for their sick child. And as THERESA mentioned, sick kids, they tend to miss more days from school. That has implications for them falling behind academically. And students who have fallen behind academically, then later in life have fewer job opportunities. They're more susceptible to chronic illnesses, like KRIS mentioned, like heart disease and diabetes. So truly, it's like a very complex and multifaceted issue.
Yeah, describing it as multifaceted, the fact that it's not just, I usually think in terms of someone's hungry and not getting a meal, but the health and ending up in the hospital and those consequences are so significant. It's interesting to hear that. So now that we understand more about the kind of the consequences and the cost of hunger, let's talk about how your organization is addressing the issue. Let's start with THERESA this time.
Yeah, so since COVID began, Second Harvest Heartland has delivered 25% more food to our food shelf partners. And we've seen a 60% increase in people seeking help since March. We really look at how we're mobilizing these resources. Second Harvest Heartland has certainly worked really closely with our community partners. So think local food shelves, especially here in the North Suburbs, programs and organizations like Keystone Community Services, in Spring Lake Park Youthway Ministries and Substance Church, to expand distributions and to really support those food shelves who are working directly in communities to build that capacity to add additional food distributions, or in some cases, to be able to add new distributions facilitated by Second Harvest Heartland, just to be able to mobilize food as quickly as possible to move it into our community. The other piece that I would say has been really paramount for Second Harvest Heartland is mobilizing our resources around vital hunger fighting programs like SNAP, or you might know it as formerly food stamps, or really supporting programs that have come out of the federal government's emergency response to the pandemic, like Pandemic EBT, which is an extra benefit for families with school-aged children, to make sure that we're really maximizing all of those hunger fighting programs, those federal dollars, and making sure that anybody who's eligible in our community can get enrolled, because we know that charity would not be able to meet this need alone. So really great example, for every one meal that Second Harvest Heartland or a food bank can provide to our community, SNAP can provide 9. And so we really see how important it is to basically pull every single lever available, both in making sure that there's food available when somebody needs it at their food shelf, that we're filling those gaps where there might not be food shelf or meal partners, bolstering the good work that's happening in the community already with programs like SNAP, the school meal programs, things that the Roseville area schools have done with their school meal programs. It's just a phenomenal example of how really leveraging those federal nutrition programs can be an important supplement to be able to fight hunger in a time like this.
It's really important to understand everything that's available and all the coordination of that, and that's where you guys specialize, I guess. So very important. Christine, sorry. Yep. Christine, can you tell me how every meal is addressing food insecurity with the pandemic?
Yeah, so we've been in the business of food insecurity even before the pandemic hit. And the mission of Every Meal is to fight child hunger through community and school partnerships. Specifically, we focus on food gaps or periods of times when youth aren't at school to access meal programs that they otherwise receive there. We started with a weekend meal program, providing students with that bag of non-perishable food items to take home over the weekend. We started that in one school 10 years ago. And we have grown tremendously since then to serving over 10,000 youth across the state, across 400 locations, and through multiple food gap programs. Really, I think a big key to our success is that we develop and support successful partnerships between sponsoring community organizations and their local schools. So the sponsoring organization helps to financially support our program in their school. And then they often also provide volunteers who actually facilitate the distribution of food and ensuring that the meal bags go home with students every week. So this partnership-based model has really helped us to make a broad and sustainable impact. But we know that there are an estimated 300,000 kids in Minnesota living in this state of food insecurity. So our work is definitely cut out for us. And we recognize that it is not just one issue that can be solved by the nonprofit sector or through the government or local businesses, but that we all have to work together to kind of do our part and rally around the community to ensure that food is getting into the hands of the kids and families who need it.
And to think that it started with one school 10 years ago and how big you've grown based on that need, that's astounding. KRIS, let's talk about Meals on Wheels. How are you addressing that?
So we currently have about 150 clients, and our local consortium, Meals on Wheels, we have expanded who is eligible for Meals on Wheels. So we even have adults 18 plus who may be impacted by the pandemic, who have to stay home to quarantine, for a few weeks, and can't go out and get meals. So we're working with kind of all ages at this point and providing meals. We serve a meal Monday through Friday. Clients are able to kind of pick and choose. Some take, like yesterday we had meatloaf, and meatloaf is a favorite day. So we have a lot of clients who take a few and freeze them for later, so that they can have the meatloaf on another day. But we serve anywhere from 80 to 150 meals a day. On some days, like just before Christmas, we were serving over 200 meals a day, because we were going to be closed Christmas Eve and Christmas Day. So, families are allowed to bulk up, but it also serves as a wellness check, because we have volunteers delivering the meals. We make sure that that they connect with the client. It's a little different now with the pandemic and making sure it's socially distanced and all of that. But if we have a volunteer come back and say that they weren't able to connect with someone, then we make phone calls and we call and check in on the client, or we call their emergency contacts just to make sure that everybody's doing okay.
Yeah, it's important that connection and knowing, and the health check aspect of that's really important. Well, we certainly appreciate everything that each of your organization is doing, but now we also want to know, what can our community members do as either groups or individuals so that we can help with this now that we know about it? Christine, is there anything we can do to help at Every Meal?
Yeah, well, like I said, there are an estimated 300,000 kids in Minnesota facing food insecurity. We're serving roughly 10,000 of those right now, so there's room for more to be done. And really, we say two things are needed for us to be able to feed more kids, and that is volunteers and money. So for volunteers, all of our meal bags are packed and assembled by volunteers at our warehouse in Roseville. We'll also do mobile packing events, or at least did in a pre-COVID world. In 2020, though, we did have over 6,000 individuals serve over 1,900 hours with us. So we definitely could not make this happen without the people power provided by volunteers. We did just resume packing events at our warehouse in Roseville, kind of after a brief hiatus, but we definitely welcome you to come check out our website, everymeal.org, to look for those volunteer opportunities. We have a number of openings through February, and definitely are keeping everybody safe by limiting it to groups of 20 or more. We have lots of space to spread out, make sure that everybody is social distancing and following other COVID best practices of wearing masks, washing hands frequently, etc. So please come volunteer with us. We'd love to have you. Additionally, donations. Every contribution, large or small, really has a tremendous impact. We purchase over 95% of the food that we distribute, which allows us to be strategic in terms of what food is going out, making sure it's food that is going to be beneficial to the families that we serve, and have different options available based on different dietary preferences. So whether it's a one-time individual gift, or you become a sustaining monthly donor, or if you are part of a group that would be interested in becoming a community sponsor, whether that's a faith group, local business, a civic group, etc. We have a large number of schools on a wait list that would love to have our program, but we just need that community support in order to make it a sustainable and lasting partnership. So those can also be found online, those opportunities. So please just check out our website, everymeal.org, both for those volunteer and donation opportunities. We'd really appreciate it.
Oh, great. Do Good Roseville has done some group events, and we will be at Every Meal one of these in an upcoming time to get a group together to try that out. And really the idea that schools need sponsorship is really important to know that. So that's good for people to, and faith communities and things, other groups to consider. So thank you for that. KRIS, for Meals on Wheels, what can community members do?
Well, just like Christine, we also utilize volunteers and donations as well. So our volunteers, we have kind of two sets of volunteers. We have packers, people who come in and help pack the meals and get them ready to go out each day. And then we have delivery drivers, people who take the meals and then drive them to our clients' homes and deliver them, kind of provide that wellness check, as I said before. But we're doing it differently now. So you go to the door, kind of go to the door, knock on the door, and leave the meal either kind of on the stoop, or attach it to the door handle, and then you step back and wait until the client comes to retrieve their meal, and then you could just check in with them and wave and say hi. And all of our delivery drivers and packers wear masks, and we have hand sanitizer, and all of that. But then we also do accept donations. Many of our clients are on a sliding fee scale, so they pay what they can based on their income, and then we accept individual contributions, and then we have some additional funding from Ramsey County, our Senior Services Consortium of Ramsey County, and Metro Meals on Wheels as well. So volunteers and funding is what helps us as well. And you can look on our website, which is isd623.org, for more information on Meals on Wheels.
Oh, great. I have delivered Meals on Wheels before. And I thought about it. Now, I thought about doing it again and was wondering about COVID, but you make it sound very safe to do that. So I think I may have to be one of those volunteers coming up. So look for that. Look for my name. THERESA, Second Harvest, what can the community do to help Second Harvest?
Well, I mean, if there's anything that you're taking away from what Christine and KRIS had shared, I'll certainly echo. Fighting hunger doesn't happen alone. It's something that we do as a community, and so certainly we would be excited to welcome any volunteers. We're just starting to get volunteers back into our new facility in Brooklyn Park. We certainly have volunteer opportunities at our Maplewood location as well. But really thinking about how we space things out, keep everybody safe, and just have an urgent and critical need right now as we're just getting volunteers back into our spaces in small groups to be able to pack food and make sure that we are really able to deliver food to those food shelf partners and really can get food to where it's needed in the community. Certainly, I mean, kind of continuing on the theme as this doesn't happen alone, also would love to just encourage folks right here in Roseville to think about finding your local food shelf and, who is in your neighborhood and really reaching out to them, whether that would be hunger fighting organizations like Keystone Community Services, like I mentioned, certainly some great work happening all across the northern suburbs with various food shelf partners. So, certainly reach out either to Second Harvest Heartland, or you can find your local food shelf at hungersolutions.org. There's a great map where you can type in your zip code and find the food shelf closest to you. Certainly would also encourage donations, whether that is to your local food shelf organizations like Meals on Wheels or Every Meal or Second Harvest Heartland. At Second Harvest Heartland, for every dollar that you donate, Second Harvest Heartland can turn around and work with partners to move the equivalent of 3 meals worth of food. And so your dollars go really far in this hunger relief work. And we certainly are really grateful for the ways the community continues to really think about how we can meet the needs for all of our neighbors. The last piece that I will mention for community members, one of the most important ways that we fight hunger is by connecting with our state elected officials, our local elected officials, and just letting them know that as a community member, I care about things like access to school meals, and I want those programs to be strong. I care about making sure that our food shelves have the infrastructure and support that they need. I care that these happen in our community. So certainly, follow us at toharvest.org/advocacy if you are interested in learning about just easy ways from your home or with Second Harvest that you can get involved in raising your voice and making sure that hunger is an issue, and that as a community, we're all involved in really fighting to reduce hunger and eliminate hunger in our community.
Well, that's great. I really appreciate the perspective that there are things you can do from your home to be an advocate for it, and contacting your elected officials, to let them know. I sometimes feel like kind of with our local city government, not that many people are watching the city council meetings and paying attention. And so if you make a voice, you're sending an emails and you're contacting them, I think that your voice will be heard. So I think that's really important. So thank you for that.
Yeah, and it means a lot coming from citizens to say, hey, this is important to me.
And so anyone that sees this program, send an email and get and check out what you can do to let people know about that. It's really important. Those are some great actionable ideas. And I want to thank everyone for all the information and for sharing your stories about that. Now we want to give everyone 1 minute to offer a final thought or key takeaway you'd like us to have. So KRIS, what do you have for us? Do you have one last thought?
Well, first I want to say thank you to everyone for watching today and listening and working to be part of a solution for all of the the families and the children to seniors who are food insecure. So thank you for that. As THERESA said, just reach out to your local areas and talk to people about what you can do and how you can help, and just be aware that this is an issue that affects so many people, and think through how you can be an advocate.
Great,
so
thank you.
Thank you again.
Thanks. THERESA, do you have a final word for us?
Yeah, final thought. One of the things that we've seen right now is that when someone may be suddenly at risk of feeling food insecure for the first time, it can feel very isolating. And if you or somebody that might be at that moment of saying, maybe I do need a little bit of help, reach out. ToHarvest.org, you can find out resources in your area, get connected with personal support about how to kind of navigate that. And what is to me so encouraging is that our community has really rallied around hunger relief. There's some really great organizations here in the northern suburbs and across the entire state who want to make sure that nobody is in that moment of, I'm just not sure if we're going to make ends meet today. So toharvest.org to both find out how you can get involved and fight hunger, or if you or somebody you know is looking for just a little bit of support and get back on your feet.
Well, thank you so much for that encouragement for people to seek help if they need it. I mean, when you're thinking of 1 in 9 or people, and I look down my block in my neighborhood, that means that of the 30 houses in my block, there's 3 of them that are probably food insecure at this point. And that's really a shocking to think about that, about how many people are impacted by that. Christine, talking back about the Every Meal and Children, do you have a final word for us?
I guess my thoughts kind of went in a similar vein with THERESA, but that just hunger is often a very hidden problem and issue in our community. And for so many Minnesotans, they're experiencing it for the first time this year with COVID and so many businesses shutting down and unemployment increasing, that so many families are just in a hard place that they never anticipated being in. And so just that encouragement that there are resources, there are programs, there are organizations out there that are doing really great work and want to provide support to these families. So as THERESA mentioned, check out those resources online and find the assistance that you need. In terms of Every Meal, please come help us volunteer, help us pack those bags as we seek to add on more schools. And if you're interested in becoming a community sponsor and helping us to onboard even more schools, especially as we look to the next school year and get geared up for that, we would really appreciate that support.
Oh, thank you. Thank you. Well, thank you all for joining us today on Compass. We've learned a lot about this important topic, and we hope that it gives people that are watching some new insights into what is happening right here in our community, on the houses on your block, and also some ideas, lots of different ideas of things that you can do to help your neighbors, whether it's from your computer at home or whether you're out packing meals. There's lots of things that all of us can do to help out. I want to thank our viewers for engaging in this content. On the Do Good Roseville website, we have more information and links on food insecurity. And from 9 North, for more content like this, check out our new website, www.9north.org. Please follow us and share us on social media at 9 North Media. Thank you again, everyone, for your time. We really, really appreciate it.
Wow, that was powerful, you guys.
Oh, good.
That was